and welcome again to another Max Doc Talk. Today, joining us is the urology expert, Dr. Waheed Zaman, Director of Urology and Renal Transplant here at Max Shalimar Bagh. Hello, Doctor.
Hello.
Men often overlook their own health while being providers and protectors and are well known for ignoring unusual symptoms given by their bodies. Today, on the occasion of Father's Day, we will discuss in detail how men need to be more vigilant towards their health, commonly occurring health issues in men and their solutions, and lifestyle patterns they need to take care of. So, doctor, many times our body sends us a lot of signals and indicates changes in health. What could these changes generally be and what are the causes?
There are various changes in day-to-day life, and if we are vigilant, then we can notice this, like hair fall, loss of appetite, and then constipation. If constipation is there, then you have to increase your fiber diet. You have to drink plenty of water. So these are the signals that comes, and we can rectify time to time. If fissure in the angle of mouth, then again it shows the iron deficiency. Similarly, hair fall, that is again multivitamin deficiency or iron deficiency. Loss of appetite, then that may be cause of like liver disease, kidney disease. So these are small signals we get. Sure, and we should be very careful about this, and we should not neglect all these symptoms in day-to-day life.
Do men carry more stress and face more anxiety concerns?
Yes, our life is very busy, and in day-to-day life they face a lot of stress in their workplace, and definitely if they do suffer from this anxiety disorders, it should be diagnosed timely and treated properly with good counseling. So we should not we should not be ignorant of this, and we should give priority to our health, and every small issue should be addressed in time.
How can they lead a more active lifestyle?
We should have good diet, healthy, balanced diet. We should do regular exercise. Whatever we are doing, like jogging, running, then cycling, it should be done regularly, and it should not be exaggerated. Means you should not do exercise for 2-3 hours at a stretch unless you are athlete and mean to be. Means it should be 30-45 minutes regular exercise should be there. Drink plenty of water, and avoid smoking in day-to-day life, and alcohol consumption also should be limited, and in this way we can lead normal life.
What screening tests are strongly recommended for men and at what ages?
Usually after the age of 50, there are few important like colonic cancers. We have got like simple occult blood in stool that can be काले रंग का latrine होना. Simple occult blood in stool can be detected. Then PSA, serum PSA, simple blood test, and within the same day you will get the report, and this blood report will tell about the presence of prostate cancer. As we know, this is one of the commonest cancer worldwide, and if family history there, then definitely it should be screening should be done at the age of 40. Then we should have regular weight measurement, BP should be measured regularly. After the age of 40 and 50, we should be very careful about this. We should take low salt diet, low sugar. So definitely we should check in day-to-day life about our sugar level, and we can control our diabetes and hypertension in this way by simple screening. These are screening tests like blood sugar and this blood test.
What are the most common health concerns that men face after an age of 40 or 50?
As we know, we are having very busy life, day-to-day life, and we are very prone for hypertension, diabetes. These are the major diseases, and we should be regularly. We should take about this. Should be concerned about this, like diabetes, hypertension, then cancer, chronic kidney disease, pulmonary disease, and in men also erectile dysfunction is very common, lack of libido, premature ejaculation. We should not hesitate to tell your doctor about this, and you can have healthy man's life with this.
What are the biggest health threats to men?
The two most common health threat is, if you see, it is cerebral vascular accident, heart attacks and strokes. So we should be very careful. We should have regular checkups, like for blood sugar and blood sugar, as well as for the BP, for hypertension, and regularly it should be checked. And definitely we can check this threatening diseases like stroke and heart attack with this. We should take low salt diet, low cholesterol. By this preventive measure, we can avoid this complications in our life.
How is smoking and alcohol damaging the quality of life?
We are already living in a polluted state, and definitely we should not do smoking. It is injurious for health. We are just reading, we are not following it, and it is injurious for family also. We give sort of passive smoking to our family, our children, and that is not good. As a father, I will say we should check all this, and we should limit or restrict or stop smoking, especially at home, because it will lead to many cancer disease. You are very prone to hypertension, diabetes, and many erectile dysfunction even with the high smoking. So it should be restricted. It is responsible for many, it affects many organs, like from lung, liver, and many other organs, that leads to various types of cancers in men. So smoking should be avoided.
What foods are good for men's health and are strongly recommended?
Yeah, we should have high fiber diet, green vegetables, plenty of green vegetables, and fruits, fruit juices. There are, and we should avoid, again, as I told you earlier, like high salt, because that will lead to, again, hypertension. Junk food, avoid junk food, and many soft drinks are full of sugars. You should avoid all this. It should not be at your home regularly. You can enjoy in some parties, etc., but it should not be taken regularly. Rather, you should take plenty of water. Lemonade, our Indian drink, lemonade, coconut water should be taken regularly. That gives lot of minerals, antioxidants, and fruits are it's very important. They gives lot of minerals to our body, and it should be taken regularly. Similarly, with green vegetables, we can have our normal bowel movement. There will be less constipation. Those who are taking non-vegetarian diet should take eggs, then poultry, and reduce their red meat intake, definitely. And we should drink milk, and we should take milk products regularly.
Urinary incontinence and prostate cancer are very common in men nowadays. Can you shed some light on these issues and the ways to prevent them?
Yeah, incontinence means we are unable to control urine. This might happen with the various stroke patients, or those who are having prostate problem or urinary tract infections. They can have also urinary incontinence, means they are unable to control. It may be like sort of urgency, and you are running to toilet and unable to control it. That is called urge incontinence. So we should consult our doctor, and regularly you should have checkup on this, that is there any urinary tract infection. Then similarly, if diabetes is there, that will also lead to frequency of urine and incontinence. And similarly, there are other causes of urinary incontinence also, like stress incontinence. These are for the old people. They should do Kegels exercise. Following prostate surgery also we can have incontinence, but we do care, and we can control this. Kegels exercise is also very important. This is sort of yoga. By this we can control our anal tone and sphincter tone. So we should do this and consult your doctor if you are having this. Don't take it lightly if you are having urinary incontinence. I think second part was prostate cancer. This is the world's, if you see overall in the world, this is the commonest cancer worldwide, and in India also, and second commonest cause of death worldwide. So we should be very careful by regular screening test. As I suggested earlier, serum PSA should be done after the age of 50. There is no recommendation till now, but what we advise, once in a year or two we should do serum PSA test. So by this, almost 70-80% of prostate cancers and early detection of prostate cancer can be done. If early detection is there, then various modern treatment are available. Like in our hospital, we have got now a robot. So robotic prostatectomy can be done if early detection is there, robotic or laparoscopic way. And no more we are doing open surgery. So we can reduce the morbidity significantly with this latest armamentarium. And if it is advanced disease, then definitely still treatment are available, and majority of the patients can be treated with this even in advanced disease. And उनको निराश नहीं होना, and go and consult your doctor immediately and do regular serum PSA at home, those who are above 50. Another important point, if those who are having important family history of prostate cancer, then it should be, screening should be from the age of 40, and it should be once in a year or two it can be done. And we can avoid this, means we can detect early prostate cancer. That is the hallmark, I will say. Early detection is very important. It is curable disease if it is detected early.
What do you suggest men to discuss with their doctor during their next visit?
Yeah, whenever you are visiting your doctor, definitely you should plan properly. You can pen down whatever symptoms are there. Otherwise you will भूल जाएंगे आप डॉक्टर्स के पास जाए. Be relaxed with doctor, be honest, and share all your symptoms honestly. Definitely you tell the family history, don't hide it, because that gives various clue for the diagnosis. And once you are talking to doctor, ask about the disease and what are the treatment modalities available, what are the other options available, what are the drugs, why this surgery is done, what are the side effects of drugs. You should ask your doctor. And if nothing is done, then what will happen? That is also very important. And any other modalities for any alternative method for the treatment of this particular disease, that should be also discussed with your doctor.
Thank you so much, doctor. Before we leave, I would like to remind the audience that if you have any questions, please let us know in the comments below and we will get back to you. To book an appointment, call the number on the screen or click the link in the description. Once again, thank you so much, doctor, for sharing these important insights and making the fathers in our audience more informed and aware about their health.
Thank you. Thank you so much for giving me this opportunity today. Thank you.